Health IQ Podcast, The Power of the Pillbox. Simple habits for healthier you.
We are honored today to have one of our local pharmacists, Brian Wilson, visit us with a topic about the importance of taking your medication correctly. Hello, I am your host, Brenda Bishop, and my crew today is Bobby Hockaday and Joyce Runyan, and you are listening to Health IQ. Thank you, Brian, for joining us. We're excited we finally got you scheduled in. It's been a couple months since we've been trying to find something that both of our schedules work. We felt this was a super important topic. And can you tell us why it's important that we take our medication as prescribed and on time and all those things?
Sure. Medication is dependent on the body's processes, how it's metabolized, how it's used, how it's absorbed. So when a medication is prescribed at a specific time or a specific dosing frequency, there's a reason for that. It's not just necessarily 3 times a day. There's sometimes a reason why it needs to be every 8 hours because of how the medication stays in the system and how it's used by the body. So when the prescriptions are very specific in their directions, it's very important to follow those directions to get the maximum effect of the medication without the unnecessary side effects.
Yes. And so a lot of them will say 3 times a day. So what is your recommended schedule for 3 times a day?
For medications that are not like antibiotics or something like that, generally breakfast, lunch, and dinner is fine. If there is a medication that doesn't fall within that flexibility in scheduling, then we would indicate a more rigid adherence to a schedule. But for the most part, a lot of people, it's like, well, I can't have this with me at work, or my kid doesn't get off until after school, they can't have the medication at school. It's like, well, okay, if they take it in the morning and then take it as soon as they get home from school and then take it at bedtime, most of the time, that's not a problem. That is appropriate enough. It'll cover the needs for the illness without being detrimental.
So you mentioned antibiotics, which made me think about the amount of time you should take at the length, how many days you should take medication. That if you have 30 pills, you should take all 30 if it's especially an antibiotic or.
Correct. And that's a common thing I think most everybody experiences, including people in the health community, pharmacists included. Many times I don't finish my antibiotic series, which just goes to show how common it is. I'm not excusing it at all. Antibiotics should be taken for the prescribed period of time. Several antibiotics, several illnesses can be treated in 3 days. Some more commonly 5. We see routine infections 7 to 10 days, but they need to be taken for those full period of days, even if the patient isn't showing any signs of the disease, or if they suddenly feel better because they've started the antibiotic. It's still important to take the full course because the antibiotics kill off the bad bacteria, but if you stop it early, you've only killed off the susceptible bacteria, and there can still be bacteria lingering that now is only stronger because there's no competition. And so you're selecting for organisms that are going to be hardier, and they're going to be harder to kill. So if you take it as prescribed for the duration of the therapy, more than likely you're going to have a successful outcome with that antibiotic.
I know when my kids were little, it was so hard to do all those days with that sticky pink stuff.
and that's the sticky pink stuff is still very common, but we're seeing more and more antibiotics that have a more convenient dosing schedule, like once a day for 4 or 5 days rather than 3 times a day for 10 days, which can be tedious, and life gets in the way and things get funny.
Yeah. So, speaking of kids, and there are a lot of tricks that we can use to get especially liquid medicines down our children, but some of them involve the the implements that we use to dispense the medication. So you often provide things in the bags, or you used to?
Yes, we do. For all, well, I shouldn't ever say all. All is kind of
Yeah.
an absolute. Generally speaking, we offer syringes if we don't outright put them in the bag. We'll have syringes that have the appropriate dosing marked on them. We've recently changed to a new vial. We have a new vial provider, and our lids are all uniform. They're all the same size, regardless of what bottle you're looking at. And we have stopper inserts for liquid medications that, so they help maintain the medication in the bottle, but they're made to fit the syringe. So then the syringe goes right into the stopper and you can draw out the dose without having to pour it out or dip it out or
Stick
however.
your syringe
Yeah,
in there
exactly.
and get the
Draw
little
it up
corner.
and try and get the right amount. Yeah, exactly. So now you can just stick it in and draw it to, just like you would with an injection. Yes.
Yeah. Oh, well, that's cool. I would have liked that.
And we have the syringes and now the bottle toppers. Those are all complimentary. There's no extra charge for those.
The syringe was a lifesaver when my kids were little, as far as trying to get that so they wouldn't spit it out. But those of us who are maybe a little more mature, and we should still use some kind of measuring aid for our medications.
For liquid medications, for sure. It's common to see prescriptions written as 1 teaspoon twice a day, but a teaspoon is not a very exact measurement, and a lot of people just think that's a spoon they have in their drawer at home. But a teaspoon, pharmaceutically speaking, is 5 milliliters, and in fact, the Institute for Safe Medication Practices has recommended to not use teaspoon or tablespoon as measurements, to always listing in milliliters, so that it's an exact number, and those syringes are calibrated in milliliters, so they correspond to the milliliter dosing of the medications.
Yeah. And even the cups are milliliters, I've noticed.
Yeah, the dosing cups have they'll sometimes have teaspoon markings on them as well. A lot of things do have both. But anytime something is written as a teaspoon or a half a teaspoon or what have you, we try to put on there the milliliter equivalent as well to drive home the importance of getting the correct dosage.
So a lot of people think maybe I want to save money and like take my pill every other day instead of every day, no matter, what, if it's a blood pressure pill or whatever kind of pill it is, or cut them in half. Is that a good practice?
Not from a dosing standpoint, no. If your dose calls for half a tablet, that's fine. But if your dose calls for a full tablet, taking half a tablet, trying to stretch it out is inappropriate for chronic medication treatments. It would be acceptable for, say, pain control. If you're taking something for pain and a half a tablet may be effective for your pain without giving a full dose, there's nothing wrong with that. But taking like heart medication, your diabetic medication, your antibiotic, you need to take the full dose.
Okay. And if you are prescribed a half a pill, are there tools that you all have that can help them cut those up? Because I have a really thin knife, but it's hard to cut something in a half.
Most tablets that are acceptable to be split already have a split in them to make it splitting easier and know where to split if you're going to be using a cutter. We have tablet cutters available, tablet crushers for medications that can be crushed. The tablet cutters do a good job of getting the tablet cut in the right size. An important thing to consider with most of those, sometimes people try and gently cut the tablet, trying to make sure it doesn't crush. Sometimes that causes the tablet to crumble even worse. The best way to do it is get it lined up and snap it quick, and that creates a clean break. A lot of tablets can be broken just between the fingers, but a lot of people, especially older people, may have difficulty with that manipulation.
Speaking of older people, do you have special tops for the jars for them who can't push and turn?
We've always had two different types of lids. We've had child-resistant lids and we've had snap caps in the past. The new vials that we have now are convertible to be child-resistant, and then we just pop a ring, and then they just twist off. They don't snap now, but they do twist off without the child-resistant frustration that we're also familiar with.
Yes. Well, on certain ones, some of them aren't bad. So I know a lot of times as our medication becomes more computerized and all that, you probably see what a lot of people are taking at once, so you can see if there's some kind of allergic reaction type thing or adverse reaction that they shouldn't take a new prescription. I assume that that's the case, but should they tell you what other things they're taking, or if they're getting something new, should people tell you what they're taking?
The computerization has advanced that.
Mm-hmm.
Most computer systems, I believe, would be compatible with that. They all have those types of warnings, but data is only as good as the data we have. If we don't know you're taking something over the counter or a supplement, a vitamin or something that could interact, there's nothing for it to check against.
Right.
So the best practice would be to let your doctor and your pharmacist know everything you take, including over-the-counter medications, and in what dosages. Our computer system we can accommodate profiling drugs that without entering a prescription, but it would still be on your profile so that it would check against any new medications being added. And besides even information we don't have, a lot of people use mail order service, or they're traveling through and they're getting a prescription from their regular pharmacy is somewhere else, but they're just getting something they need today here or wherever they're traveling. Provided that the prescriptions are being transmitted to a patient's insurance, the insurance also keeps track of that. We receive notifications all the time of prescription that we're filling today that interacts with something that they got somewhere else. And that is helpful as well.
So years ago, I remember we would take sacks we'd have people come to like the wellness fair with a sack of their medicine, and the pharmacist would sit there and say, you shouldn't take this with this, or, all that kind of stuff. But so basically the computer has sort of taken over a lot of that for you.
It has.
But they could still bring their sack in?
Of course. Of course. Anytime someone has a question, I know being the only pharmacy in town, we are quite busy. We've had people comment when they come in and happen to be the only person standing in line that they've never seen it empty. But anytime there's a question, we're there to help people. We want people to ask questions. We want them to be confident in the medication they're taking. And anytime there's a question that we can answer, we certainly will.
And especially if it's a new prescription, they should ask you questions about potential side effects and things.
Of course. Our policy is to question a patient on new prescriptions. Just because it's new for us doesn't mean it's actually new for the patient, and they may be familiar with it. And we ask, is this medication new for you? Do you have any questions for the pharmacist? And we frequently wind up intervening and having conversation with a customer.
Yeah, I see the little window over there, and there's always people there. Yeah. So that's pretty nice. I'm at the pharmacy a lot, not always for prescriptions, because you have other services as well. So before we go to those other services, I did want to mention about the food and drug interactions. You often will put that on the labels as well. But that's pretty important that we make sure we follow those.
Yes. Some medications should be taken with food, some medications should be taken without food, and some medications may interact with certain types of food. So we try to highlight those and point those out and make sure people are aware.
Yeah. I have one you have to take before you eat or drink anything. So that's always, a challenge too. So other services that you offer in the pharmacy other than the prescription drugs?
Besides the prescription drugs, we have a fairly comprehensive line of over-the-counter products. We have vitamins and supplements. We have our cold and flu section. We have first aid and some skin care. We have a women's health area. We have our ophthalmic and otic area for eyes and ears. We have first aid, if I didn't mention that already, I don't remember. We have compliance aids as well. We have pill boxes, pill reminders. I use 2 pill reminders myself because of the amount of medication I take and the frequency I take them. I have 1 box for my morning meds and 1 box for my evening meds. And it's always helpful for me just so I know, did I take my medication today? And that's a simple fix for also knowing when you're going to be out of medication because you're setting up your box, you're fixing to run out. You don't get caught unawares.
Right.
Oh, I'm out. Oh, it's the weekend. Oh, what do I do now?
Right. I also noticed that you have a lot of, I don't know what they're called, orthopedic devices or, knee braces. You have crutches, canes.
Yes, we have or have had bath benches, shower chairs. We can get wheelchairs. If there's something that someone needs that we don't have, we can look and see what it would take to get it and how much it would cost. But we do have crutches and canes. We have
the
elevated toilet seats, and we have the wrist brace and knee braces and several of those.
And you have the special soap if you're going to have a surgery.
Yes.
That you have to have. I noticed that.
We've had to stock up on that recently.
Bought that myself. So that all those things you have, but you also offer vaccinations during certain times of the year?
Carlos can prescribe and administer the shingles vax and the RSV vaccine. Shingles is only indicated for adults over 50, and the RSV is only approved for our purposes for prescribing and dispensing for patients over the age of 60 years of age. It's also indicated for some other age groups, but we're not set up for that clearance. So we have the shingles vaccine and the RSV vaccine currently, and Carlos does those Tuesdays and Fridays by appointment.
But the shingles vaccine, I think that's a wonderful service because when I got mine, I had to get my prescription, take it, then I had to wait till it got filled, and then I had to call the doctor and say, is now a good time? Then I had to go get the prescription, drive to the doctor's office for the nurse to administer it, and do that twice. And so that's sort of a pain, and now people can just make an appointment and come in and do it there in one place and not have to go to the doctor's office.
Yes.
So
we can bill most patients' insurance. Most patients' insurance, it is no cost for those. So I'm not going to say all, but most.
Almost, yes, because it's considered a preventive.
Yes.
So I thought about your other service. I noticed you have the blood pressure machine.
Yes, we've had that kiosk for many years, and it gets a workout.
And then, of course, why I'm at your pharmacy all the time is your UPS services.
Okay, I'm glad you asked about that. I was going to bring it up. We are a drop-off service for UPS. The thing to distinguish there is between a drop-off service and a UPS store. A UPS store can do everything that UPS can do. And they have the packaging and the technology to do the QR code. We do not. We take the UPS drop-off packages as a service to the community, and UPS just picks them up from us. If you are shipping the product yourself, you're paying for the shipping. As long as it's boxed up and we have the address, we can weigh it, measure it, print the label, and charge you your fee and send you on your way. If you're doing a prepaid return, like from Amazon, where it's very common, whatever service you are processing your return through, you need to choose UPS drop-off and get a regular barcode label or paper printed, whatever. As long as you have it prepared, we can take care of it from there. We're not able to print out your labels, and we're not able to do the little square QR code.
Yeah.
So.
But it's still a nice service, and we don't have to chase our UPS driver down, which I have also done, and showed up at people's houses I don't know, so I can give something to the UPS driver. So I appreciate you all for doing that. I'm sure it is a big hassle at certain times of the year.
Well, I won't say it's a big hassle. It's really minimal, but I'm pleased that we were able to pick up the ball, if you will, when the UPS store here had to close, so that people still have an option locally to take care of their packages.
Yeah. So is there anything else I didn't think to ask you about that you want to make sure we included?
I did want to mention our delivery service.
Oh, yeah.
We do deliver medications. We only deliver one time during the day just because of our schedule. We don't have someone just running around delivering all day. We deliver in the afternoon after 3:30. It's $1 delivery charge for essentially a 2-mile radius of Tucumcari. We don't deliver to the outlying areas, but in town we do deliver. And for patients that are outlying, we have mailed prescriptions before.
Mm-hmm.
Sometimes there's a little bureaucratic restriction on some of that, so it's not always freely available. And postage is a little expensive.
Yeah.
So unless it's going to beat your gas prices.
But if you are not feeling well and don't want to go out your door to get, it's well worth that $1.
Exactly.
To have that delivered to you. So I'm glad you remembered that. We do want to thank you for coming, and we have you a gift. This is a Health IQ cell phone holder.
Thank you so much.
So you can watch your podcast.
I need one. The stand on my phone broke.
So anyway, it's pretty nice, handy to have just that. Put your phone up there and you can know where it's always at. And I want to thank you all for joining us today. And I encourage you to get that Pillbox. Make sure you have your prescriptions lined up for the month. It has really helped at our house to do that. Well, not the month, the week, but every week to set up our Pillbox so that we know that we've taken them. And most importantly, if you have a question about what your medication or if interactions, ask your pharmacist.
Absolutely.
So when in doubt, ask. And come back next time as we will have another important health topic for you and your family.
Special thanks to our guest contributor this episode, Brian Wilson, pharmacist and owner Mesa Winds Health Mart Pharmacy. Our host was Brenda Bishop, and that brings us to the end of another episode of Health IQ. We had a great time putting this together for you.
Absolutely. We couldn't do it without the whole team. A big thank you to our director, Robert F. Hockaday.
And to our producers, the team behind the curtain. That would be Robert F. Hockaday and Joyce Runyan.
They're also the ones who handle all the technical stuff, like the video and audio. Again, that's Robert F. Hockaday and Joyce Runyan.
And for all you camera enthusiasts out there, the camera operator for this episode was Robert F. Hockaday, with Joyce Runyan as our second assistant camera.
And finally, a huge shout out to our amazing editors, Robert F. Hockaday and Joyce Runyan. They're the ones who make us sound good.
And of course, we can't forget the music. Special thanks to David Morris for providing the credit music.
That's it for this week. Thanks for tuning in to Health IQ.
We'll see you on the next episode. Funding for this podcast is provided by New Mexico Legislative Appropriation from Representative Jack Chatfield. Brought to you by Quay County Health Council. Follow us on YouTube, Facebook, and Instagram at Quay County Health. If you have content ideas, reach out to us at healthiqpodcast@gmail.com.
This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.